recurrent epistaxis, it is the last case scenario, or we can say last two case scenarios, because now we have two case scenarios. One who is 5 years old, one who is 50 years old. Does anyone, guys, know here? This is the only case that we can open as an interactive case. Let's see what are your thoughts. Because without doubt, I'm sure, guys, some of you had before recurrent epistaxis. What do you think, guys? What are the questions to ask in recurrent epistaxis? Anyone would like to volunteer and tell me few questions? Anyone who is sitting in September?
How often they're having this epistaxis?
Good.
And how much blood they're losing each time?
Good.
Any triggering factors?
Okay.
Is this from one side or both nostrils?
Well, yes, very important, definitely. What else?
Any other symptoms like blocked nose, runny nose?
Good. Okay. What else?
Maybe other ENT symptoms like any ear symptoms? I'm not sure how it is related, but I thought maybe it's linked with any ear
Oh,
symptom.
could be, yeah. You know that nasopharyngeal carcinoma sometimes can come with unilateral bloody nasal discharge, unilateral ear pain, unilateral sometimes ear fullness, all of that. Okay.
Maybe weight loss
I see.
history.
All right. Okay. What else?
Any family history?
Okay. Maybe, and especially family history of bleeding disorder. What else?
Any other bleeding tendencies?
Okay. What else? Right. Anyone else, guys, would like to add a few more questions?
Any trauma?
Good. Trauma. Yes.
Any
Well,
other medication?
well, good. Over-the-counter medications, ibuprofen as well, especially if your patient is old. It might worsen the bleeding. Non-steroidal. What else?
Family history of
She mentioned that she
bleeding.
about that. Okay. If
Any
some
nose prickings, anything
yes,
habits like?
good nasal picking is very important. Many people like nasal picking, and many kids. Not only this, sometimes kids put foreign bodies as well. Okay. What else? We mentioned if someone coming with frequent bleeding from anywhere, we could ask about anemia. Ask about anemia. Some symptoms of anemia. Not only this. Not only this.
Her
If
job and the cold weather exposure to some dryness.
okay, could be. Yeah, could be from dryness, by the way. Yes. All right. Let's say your patient is 50 years old. 50 years old. Might be hypertension. Might be hypertension as well. Hypertension. That's why we need to bring them for face-to-face. We need to bring them for face-to-face to examine the blood pressure. All right. So if your patient is having recurrent epistaxis, guys, what you need to manage or what you need to do in the management? Let's say you have 5 years old and you have 50 years old. Okay, I will tell you guys. Let's say you have 1 year old, 1 year old, 5 years old, and 50 years old. How you will manage them?
Less than 2 years, we have to refer. We have to make sure doesn't have any anemia or leukemia.
Well done. So the first step here, epistaxis likely to have underlying cause if your patient is less than 2 years old. That's why we refer this patient if he is having epistaxis and less than 2 years old, because it might be a sign of leukemia or might be a bleeding problem, bleeding disorder. So the first take-home message from this, epistaxis, less than 2 years old, push him to pediatric. Then the 5 years old, what you will do for him? how you manage 5 years old.
If doesn't have any underlying disease or condition, we can start Nizeptin. I'm not sure.
Okay. Will you bring him for face-to-face?
Yes.
Okay, so face-to-face. All right. You may offer some blood tests, like especially if he's having frequent bleeding, to make sure there is no any anemia or clotting disorder. You can offer also clotting screen. Naseptin cream. Does anyone know what are the allergic questions you need to ask about Naseptin cream?
Not.
And soya. And neomycin. Because if he's allergic to this, you will not give him this cream. You'll give him a different cream for campuses. All right. So in the management, face-to-face, you may arrange some blood tests. Then self-help measures are very important. What patient can do, there are many things. What we can offer face-to-face, maybe some plus, and we can offer also the nasal cream. Usually, it is benign, especially in the kids. It is benign, to assure. But it is less than 2 years old, it's not. We need to rule out underlying bleeding problem, leukemia, so refer. More than 2 years old, likely to be benign, but we need face-to-face. We need to look at the nose, make sure there is no any foreign body, no anything inside. Okay, so bring for face-to-face. Then we can give self-help measures and Naseptin cream or piperacin cream. The other thing in the history taking, very important, you need to ask what does the patient do every time he's having epistaxis or bleeding. Okay, because what he needs to do, he needs to pinch on the soft part, and you need to show him in the station with the soft part and lean forward. Don't do like that. Don't pinch and do like that. Why? It increases the risk of aspiration. Okay, and he needs to pinch on soft part for a few minutes and breathe from the mouth. Okay, CKS says that if the facilities in your practice and the patient coming with acute epistaxis, and you have the facilities in your practice to do a nasal packing or pottery, you can do that. Okay, I only done nasal packing once in my life in A&E, my A&E rotation. I don't like to do it. But if you have the facilities, if you can do it, you can do it. If patient is coming with acute epistaxis and severe bleeding, you need to refer him to A&E. But in the meantime, you can give some tranexamic acid. So let's go through the questions. But before that, if your patient is 50 years old, face-to-face, and don't forget blood pressure check, and full blood count, and clotting screen. You can also do liver function test. Okay. Also, for the current epistaxis, it's very important to ask about what? To ask about, in the adults, alcohol intake. Any liver cirrhosis signs and symptoms. Advanced liver cirrhosis can come with epistaxis because the platelet dysfunction. Over the counter, as we mentioned. So let's go through the questions, and you'll find that many questions are really making sense and very important to ask about it. So when did your symptoms start? How often do you bleed? How long does it last? Which side, as you mentioned, guys? Is it heavy or no? Any difficulty stopping the bleeding? Any other symptoms, especially bleeding from other side? Any recent trauma? Any nasal conditions? Any dryness? Any recent infection, especially upper respiratory? Ask about cancer, definitely. Exclude red flags. Any prolonged bleeding, usually more than 20 minutes. In unilateral persistent bleeding, nasal obstruction, past history of bleeding disorder, either the patient or the family, hypertension or liver disease, at least ask about some of the liver disease. Do you have any yellowish discoloration of the skin, red dots or spots in your body, vomiting of blood, all of that? Okay, especially if your patient is old, patient coming with recurrent epistaxis, is it liver cirrhosis or not? Non-steroidal anti-inflammatory, like over the counter. If definitely is taking anticoagulant, it might be one of the reasons. Social history is important. I only wrote alcohol, because this is the most important one among them. Alcohol, because heavy drinking can cause liver cirrhosis. Liver cirrhosis can cause bleeding, including epistaxis. Definitely impact on the life and occupation. How to explain? For 5 years and 50 years, for 5 years, nosebleeds in children are very common. Actually, yes, it is very common. Over the last couple of months, I had 3 kids with nasal bleed. None of them less than 2 years. Like yesterday, I had one with nasal bleed. It was 11. Yesterday, I had a very funny day. Mix of many cases. It was very busy. 2 allergic rhinitis, 3 skin rash. The 3 skin rash are very weird skin rash. 1 with nasal bleed. Many things. So nosebleeds in children are very common. Usually, it's not serious. They are often happen because of small blood vessels in the nose that can bleed easily, especially if the air is dry or there is minor irritation in the nose. We will check for any concerns. That's why I need to check and see him for face-to-face. But in most cases, they will improve with self-help measures at home. We will come to the self-help measures. How you can explain for 50 years old? I think, add here a third possibility or a third scenario if it is less than 2 years old. Because less than 2 years old, you will approach it as 5 years, but you will explain because he is less than 2 years old. You need to make sure he doesn't have any bleeding disorder, or more important, to rule out a possibility of having a leukemia. I'm not telling you it is a leukemia. I'm not telling you your kid is having a bleeding disorder, but because he's less than 2 years old, we need to exclude this as soon as possible. Okay, this is a third possibility. All right, for 50 years old, nosebleeds in adults can have different causes. Absolutely. Dryness, high blood pressure, small fragile blood vessels, drinking or liver problem, or because of alcohol or whatever. Because you are having them repeatedly or more recurrent or more frequent, we will check your blood pressure and we may need to do some blood tests to rule out other causes. Most cases, settle down with self-help measures again. Here, management, addressing the eyes. First line, again, face-to-face examination. It doesn't matter your kid is 5 years, 50 years, or even less than 2 years. Bring for face-to-face and explain that I will refer to the pediatric team to see him as urgent. Okay. Investigations if needed, self-help measure, nasal cream, follow-up. Face-to-face, ENT examination, and check for growth and hydration, all of that. For adults, full blood count and clotting screen, and I will add here full blood count clotting and LFTs. LFTs is important, yes, it's important. And verbalize your source at the exam. Why you are checking your liver function? Because actually, if someone is having advanced liver disease, it might affect or it might induce bleeding, because it might affect how your specific kind of blood count, we call it platelet, work in your blood, work on your body to stop the bleeding. Okay, platelet dysfunction. Investigation, as we mentioned, full blood count, usually in the kids, not needed unless there is red flags, bruises, prolonged bleeding, systemic symptoms. In adults, full blood count, clotting screen, and LFTs. Treatment, Naseptin. If he's having recurrent, okay, but please guys, ask about peanut soya allergy. If he's allergic, mupirocin cream if he's allergic. The same in adults. What patient can do? Again, as I mentioned, pinch the soft part for 10-15 minutes. Avoid nasal picking. Okay. Sometimes you can use Vaseline or saline gel. The same for adults. Okay. Same thing for adults. Same thing for kids. Safety net. If prolonged bleeding more than 20, bleeding from anywhere else, okay, you look unwell, please come back straight away or seek urgent medical advice. Okay. Resources, ENT UK, leaflets about epistaxis, and follow up after probably a couple of weeks to make sure the frequency has gone better, the cream is working, okay, and there is no any other features. Then acute epistaxis management. If you guys would like more information about acute epistaxis management and recurrent epistaxis, I made for you guys 2 good tables, very good tables, okay, and I think in a very well organized way. Definitely at any point with any bleeding, epistaxis or hematuria or hematemesis, if hemodynamically unstable, emergency, immediate ENA transfer. In the meantime, give tranexamic acid. First help or first aid, self-help measures. We mentioned about this. Sometimes we can put cool compress on the forehead because the cool compress on the forehead will do vasoconstriction of the blood vessels. It will reduce the epistaxis. Avoid tilting the head back. As we mentioned, doing like this, we are giving him aspiration. We are making him at risk of having aspiration. Okay. Then CKS says if you suspect posterior bleeding, we need to send him to the hospital. If there is any suspicious of posterior bleeding, we can see the source of bleeding, okay, or significant, admit to the hospital. If the bleeding stop, okay, or for the current bleeding, we need to give septic cream. Less than 2 years old, we need to refer. Okay, consider referring same day if less than 2 years old. If he is frail, bleeding disorder, taking anticoagulant, severe hypertension, other comorbidities, all of that we need to consider admitting the patient. All right. CK says if the bleeding persists with acute bleeding and we have the facilities in the primary care, we can do nasal cautery or nasal packing. I would advise just send him to A&E. Okay. Rabia, Rabia, I think, do you have the hard copy, Rabia? Okay, we'll come to the first slide, don't worry. But if you have the hard copy, because this case is new.
So this case is, sorry, this case is not in my hard copy. That's why I was thinking I would just see the.
Rabia, before your exam by 2-3 weeks, just text me. You will have for free another copy at your home with just related cases. So you will have another hard copy before your exam by 2 weeks, 3 weeks. All the new cases will be printed for you and send it to your home without extra cost. Okay?
Thank you.
So don't worry about that. Right. Where we have been, Rabia, you interrupted. Okay. Self-help measures, guys, you will find and reduce self-care advice if primary aid measures work. So if the primary help measures, pinching the soft part, it did work for 24 hours. Avoid, very important here, guys, very important, and you need to know that for the exam. Avoid nose speaking and blowing in the nose, heavy lifting, heavy exercise, okay, and also avoid laying flat all the time, and avoid alcohol or hot drinks. Especially hot drinks can cause vasodilatations, or hot showers as well. Hot showers or hot drinks, because hot showers or hot drinks can induce vasodilatations and induce again bleeding. Safety net, definitely if bleeding start becoming very severe, please seek urgent medical advice. Don't forget, if allergic to neomycin, peanuts, soya, don't prescribe naseptic cream. Then for recurrent epistaxis, again, self-help measures, avoid nose blowing, picking, heavy lifting, exercise the same, and then if less than 2 years, okay, consider pediatric referral. If it is recurrent, pediatric referral. Okay, refer him to pediatric team to rule out any clotting disorder or bleeding disorder or leukemia. When to refer to ENT, you will find many referral criteria. For example, recurrent bleeding, you suspect angiofibroma, you suspect cancer, more than 50 years old, South Chinese or North American, the origin, ethnic background, all of this. Okay, you're just knowing about some extra information just in case if the case scenario will be questioned. Again, less likely in the exam, you will need to refer the patient because most of the cases designed that you can manage by yourself in the primary care. For the recurrent, so treatment for the recurrent, face-to-face, as we mentioned, if he is a male, you need to check the blood pressure. Sorry, if he is an old patient, you need to check the blood pressure, do some blood tests, full blood count, LFTs, and protein screen. Self-help measures, if it is recurrent, naseptic cream, avoid nasal picking, blowing, avoid after every attack, okay, or after every acute attack for 24 hours, avoid hot drinks, avoid hot showers, alcohol because it might induce another bleeding attack, okay. And if less than 2 years, don't forget, we refer to pediatric team. This is all you need to know about epistaxis, the current or acute. It's important to know about because I'm pretty sure, guys, you will find some patients coming to you with epistaxis. Here is the first case or first slide, rapid. Okay, guys, any questions at all?